الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Economic Perspectives on Health, Professor Mahmoud Hani Sulaiman. We will begin to study health system administration and economics. Physicians must know these subjects to understand how to create and govern a high-quality work environment. Then I will describe these issues in Egypt in another series of videos. Subjects will be economic perspective on health, economic evaluation, economic perspective on measuring health, economics of public health problems, healthcare systems, planning health services, and healthcare evaluation. This is the scope of health economics. We will begin by the question at the top: what influences or produces health other than healthcare? This will give us an arrow goes to the planning, budgeting, and monitoring, and another arrow goes to what is health and what's its value. This question will make us make another question about economic evaluation of treatments, e.g. cost effectiveness or cost benefit analysis. This will bring us to another title, evaluation at the whole system level. Another arrow from what influences or produce health is demand for health care, which will make us go to the economic evaluation of treatments and go to the market equilibrium. And demand for health care will give us another arrow to supply of health care. And so you see all questions are related together in some way. Life in healthcare organization is a continuum of decisions on how physical and human resources are allocated. Continuum of decisions of allocation of resources against a background of limited budgets. Resources invested into one area are at expense of a lost opportunity in another, and difficult decisions are inevitable. Every decision in healthcare is a rationing decision. Expanding one service means that there is less for another service. An extra 5 minutes spent with one patient will be at expense of the next. So this is useful introduction to health economics for two reasons. First, about opportunity cost. Second, decisions. First, it describes one of most useful concepts of economics and health economics, which is opportunity cost. First, opportunity cost. For economists, true cost of a treatment, a good or a service is not money paid for it. Instead, true cost equal value of benefits forgone by not applying same money or resources to the next best alternative. So it is not money. True cost is not money. This is because most decision making in healthcare takes place under conditions of scarcity and nodra. Scarcity of resources necessitates choices, and choices always imply opportunity costs. الفرصة والفرصة البديلة. Secondly, all decisions in healthcare doctors make are resource allocated. The decisions the physicians, the doctors made are mainly resource allocating decisions. While much of medicine is about making clinical decisions made about patients by health professionals, clinical decisions, all such decisions also commit resource and so have opportunity cost. What is economics? If health economics equal application of theory and methods of economics to health and healthcare, what is economics? Economics described as science of choice or science of incentives or how markets work. Economics criticized for being over-reliant on explanation based on individuals make choices based on what will improve their own wealth and satisfaction. At the same time, its core concept of opportunity cost and analysis of cost versus benefit involved in choices provide ways to understand areas of human endeavor including health, healthcare, and medicine. A quick guide tour of health economics. Breadth of health economics shown by a wide range of questions that health economists might ask. For example, I will talk about some of these questions. What would increase in tax on cigarettes be of overall benefit to society? Increase in tax on cigarettes benefit society? Paying doctors on a fee per service will lead patients to get more treatment than they need? Is paying doctors on a fee per service lead to patients get treatment than more they need? How should changes in quality of life measured and valued? Is it cost effective to screen patients more frequently or using more accurate but more costly tests? Also, the subject includes interest in epidemiological questions as how to value life, how factors beyond health services as income and education influence health. Health economics and health systems. Much of economics is about how and whether markets work. How and whether markets work. That is, whether they are the best way to meet society goals. If the work of markets are the best to meet society goals, markets are believed to work best. This is a theory. When there is perfect information about demand and good available, and when suppliers can enter or leave market easily. So the economics say that markets work best when there is perfect information about demand and goods available, and when suppliers can enter or leave market easily. Health economics and health systems continued. Market for healthcare is highly unusual because it fails at number of levels. For example, unlike normal markets for other goods, patients have to rely on the doctor acting as their agent. The patients rely on doctors to help to decide what they need. Also, in some situations, people get value and satisfaction from other people receiving healthcare, e.g., receiving vaccination. Most importantly, though persons' need for healthcare is highly unpredictable, we generally don't know when we will be ill or how seriously ill we may be in future. For all these reasons, in most developed countries, healthcare is mostly funded collectively through taxation or national health insurance. Other markets related to healthcare, e.g. supply of doctors and nurses, are quite highly regulated because free and perfectly competitive markets generally do not exist in field of health. Free and perfectly competitive markets generally do not exist in field of health. Health economics, resource allocation, and efficiency. Given widespread recognition of market failure in healthcare, methods of health economics had an increased importance role in planning healthcare and health policy. This is due to economics provides useful methods for assessing relative efficiency of organization as hospitals and the private clinics, or purposes rational approaches to resource allocation and priority setting in health system. However, methods of economic evaluation to establish which treatments or health programs provide best value for money or are the most cost effective are probably the most widely used by health economists. So, which treatments or health program provide best value? This is answered by economy. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.